Hello everyone, you're on the channel The Middle Ages. When we think of medieval medicine, what comes to mind? Probably plague doctors in those creepy bird masks, or maybe a barber surgeon with a bloody saw ready to amputate a limb. It's a pretty grim picture, right? Bloodletting, leeches, and prayers as the only form of treatment. But is that the whole story? Was medieval healing really just a chaotic mess of superstition and butchery? Well, today we're going to peel back the layers of history and uncover the surprisingly complex and often effective world of medieval healers. You'll be amazed to discover that it wasn't all just guesswork and grim remedies. They had specialized doctors, skilled surgeons, and wise women who knew their herbs. So grab your mortar and pestle, and let's dive into the fascinating world of medicine in the Middle Ages. So, who were these medieval healers? The medical world back then was surprisingly diverse. It wasn't just one type of doctor. At the very top of the food chain, you had the university-trained physicians. These were the elite, the scholars who had studied the classical texts of ancient Greek and Roman masters like Galen and Hippocrates. They were all about the theory of the four humors: blood, phlegm, yellow bile, and black bile. The idea was that your health depended on these four fluids being in perfect balance. If you were sick, it meant one of your humors was out of whack. A physician's job was to figure out which one and prescribe a treatment to restore that balance. This could involve changing your diet, prescribing specific herbal concoctions, or, yes, sometimes recommending a bit of bloodletting. But these physicians were expensive. They mostly served the wealthy, royalty, nobles, and rich merchants. You wouldn't find them treating the average farmer. For more hands-on work, you had the surgeons and the barber surgeons. What's the difference? Well, formally trained surgeons also attended universities, but their focus was on external ailments, things like setting broken bones, treating wounds, removing tumors, or even performing cataract surgery. Yes, you heard that right. They had specialized tools and a surprising amount of knowledge about anatomy, often learned from dissections, which became more common in the later Middle Ages. Barber surgeons, on the other hand, were more of your everyday practitioners. They were members of a guild, and their skills were passed down through apprenticeships. They handled the routine stuff: pulling teeth, lancing boils, and of course bloodletting. They were the general practitioners for the common folk. While we might laugh at the idea of getting a haircut and a minor surgery in the same shop, these barber surgeons were an essential part of the community's healthcare system. Then we have the apothecaries, who were basically the pharmacists of the Middle Ages. They were experts in herbs, spices, and minerals. An apothecary shop would have been an amazing place, filled with the scent of hundreds of dried plants, roots, and exotic ingredients. They prepared the remedies prescribed by physicians, grinding herbs into powders, mixing them into ointments, or brewing them into tonics. But they also offered their own advice and sold remedies directly to the public. They had extensive knowledge of what was called materia medica, the body of knowledge about the therapeutic properties of any substance. A skilled apothecary knew exactly which plant could ease a fever, which root could soothe a cough, and which mineral could help heal a wound. They were a crucial link in the chain of healing. And we can't forget the healers who often get overlooked in the official records: the women. In every village and town, there were wise women or local healers who used generations of passed-down knowledge of herbal remedies. They were often the first person anyone would go to with an illness. They cultivated gardens filled with medicinal plants and knew the local flora inside and out. They delivered babies, treated childhood illnesses, and created poultices for injuries. While university medicine was dominated by men, domestic health care was almost entirely in the hands of women. Their knowledge was practical, based on real-world experience, and for the vast majority of the population, it was the only healthcare they could access or afford. So how did they actually diagnose an illness? A physician wouldn't just look at you and guess. They had a systematic approach. The most important diagnostic tool was uroscopy, or the inspection of urine. They had incredibly detailed charts, called urine wheels, that linked the color, smell, and even taste of urine to specific imbalances of the humors. A physician would hold a special flask, called a matula, up to the light, observing the liquid's properties to determine what was wrong with the patient. They would also check the patient's pulse, considering its rate, strength, and rhythm. And of course, they'd consult the stars. Astrology was considered a serious science and was deeply integrated with medicine. The position of the planets and stars at the time of a person's birth and illness was believed to influence their health and the best time to administer treatment. Now for the treatments themselves. Yes, bloodletting was extremely common. The idea was to remove excess blood, which was thought to cause many ailments, especially fevers. This was done either by phlebotomy, which is cutting a vein, or by using leeches. While it sounds barbaric to us, and was often overused in some specific cases, like reducing high blood pressure or inflammation, it might have accidentally offered some temporary relief. But medicine was much more than just that. Herbalism was the true cornerstone of medieval treatment. For example, willow bark, which contains a substance similar to aspirin, was used for pain and fever. Yarrow was applied to wounds to stop bleeding, earning it the nickname Knight's Milfoil. Foxglove, a plant we now know contains digitalis, was used for heart conditions, or what they called dropsy. They also had a sophisticated understanding of dietetics. Food was seen as medicine. Physicians would prescribe specific diets to rebalance the humors. A person with too much phlegm, considered cold and moist, might be told to eat hot and dry foods like roasted meats and spiced wine. Someone with excess yellow bile, which was hot and dry, would be advised to consume cool, moist foods like cucumbers or melons. It was a holistic approach that connected diet, lifestyle, and health in a way that feels surprisingly modern. Surgery was, of course, a last resort, but some of the procedures were remarkably advanced for their time. Surgeons used wine to clean wounds, which worked as a mild antiseptic. They used thread made from animal intestines to suture wounds and had tools for complex operations like removing bladder stones. They even used sponges soaked in opium, mandrake, and other herbs as a form of anesthesia to dull the pain during surgery. Let's talk about hospitals. The medieval hospital wasn't quite like the hospitals we have today. They were often run by religious orders, like monks and nuns, and their primary function was care, not cure. The Latin word they came from, hospes, means guest or host, and these institutions provided hospitality to the sick, the poor, and travelers. They offered a clean bed, regular food, and spiritual comfort. While physicians might visit, the day-to-day care was provided by the religious staff. Their focus on hygiene, providing clean water and fresh linen, was a huge step forward. For many illnesses, simply being in a clean, quiet environment with a nutritious diet was a powerful form of treatment, and likely saved many lives that would have otherwise been lost to infection and neglect. Of course, we can't deny that a lot of medieval medicine was ineffective or even harmful. The humoral theory was fundamentally wrong. They had no concept of germs, viruses, or bacteria. The belief that disease was a punishment from God or caused by miasma, bad air, led to many flawed conclusions. And some remedies were just plain bizarre, involving things like powdered mummy or animal excrement. But we shouldn't judge them by our 21st century standards. They were working with the best knowledge they had, building on centuries of observation and tradition. Within their framework, they developed a complex, logical system of healing. The physicians, surgeons, apothecaries, and wise women of the Middle Ages weren't just fools in the dark. They were dedicated practitioners trying to ease suffering and save lives in a world without antibiotics or modern science. Their legacy is a testament to human ingenuity and the enduring quest to understand and heal the body. So the next time you picture a medieval doctor, maybe think beyond the plague mask. Picture the university scholar studying ancient texts, the skilled surgeon setting a bone, the apothecary carefully grinding herbs, or the village woman tending to her medicinal garden. The world of medieval healers was far richer and more fascinating than the stereotypes suggest. What part of medieval medicine do you find most surprising? Let me know down in the comments. Thanks for watching, and if you enjoyed this journey back in time, be sure to like, subscribe, and hit that notification bell for more deep dives into the Middle Ages. See you next time.